These Kennedy sponges, because I just threw a bunch of them away.
That? Yeah, look at it. We're good to go. So they told me the deployment would probably be to Kuwait, and I told them to take my name off the list. Hey, Rich.
Yeah. You're not going anywhere anymore?
Good.
Like that.
Well, Afghanistan in 2011.
You get your training. You can either coming home from Afghanistan in 2011, you need to read the news. Alright, let's try.
How faster once we got you out of here.
You said that. You said that the last time we worked together.
There must be some truth in it.
Brutal in here, huh?
Yeah, Dr. Daniels, I know you've only worked with me once, but defend my honor from that guy.
In all fairness, I haven't finished the first case with you, so I can't defend you because I haven't assessed it yet.
Scream about it anymore.
There's a message for that.
Well, that's one thing I can't control.
Maybe you could clean them.
If I'd have sprayed them.
So this is the on-cue pain buster pump, and it's filled with 750 milliliters of 0.25% bupivacaine. And it comes in the ball, and we remove the catheter and attach it where anesthesia had originally put it. We make sure the clips are off, and then we set the pain pump. And we can control the flow rate, and for her, we'll allow it to flow at 4 mLs per hour. And then the whole thing conveniently fits into this little bag where there are instructions.
Could you just show me the balloon part again? Okay, so there's anesthetic material.
There's local anesthetic inside here that flows through this tube. It's regulated by the pump and goes into the catheter we place preoperatively.
Take it off his thigh now, here. Little sticky kind of Band-Aid feel.
Now, does the patient have to do anything with this device after you
Just carry it.
just carry it around?
That's it.
So Rich, do we have a complete end time?
Oh, it was 9:06.
Will the patient's leg feel numb, or is it
Patient's-
just for the pain?
Patient's leg will stay numb the entire time, provided that the catheter doesn't fail and nothing breaks.
And so this is instead of giving her like narcotic painkillers?
Correct.
medication?
Now, we always augment with a little bit of narcotic medication in case she has a little bit of soreness in the leg. There is one nerve that runs along the side of the leg that is not infiltrated by that particular
It can
pump.
only go down.
It's variable in its existence, and it's not near the surgical site, but with the swelling, you can get some irritation to that nerve, and we do give some pain medication for that purpose.
So in your experience, what are the main advantages of using this pain buster pump?
It reduces the necessity for narcotics, which reduces complication rates such as dizziness, sleepiness or somnolence, and constipation.
That's the catheter, which it actually has an introducer wire in it to make it easier to slide into the tissue. So once it's in the tissue, we take that inner wire out, so it's a very soft, pliable plastic material.
Now, does the catheter deliver the anesthetic only at the tip, or are there like little holes all the way?
Actually, just at the very tip.
Just at the very tip?
So we're trying to position the tip right next to the nerve, and then the way it works is it injects local anesthetic around the nerve. So as it infuses it out of the tip, it'll go circumferential around the nerve and absorb inside the nerve.
Now, will the patient feel numbness in that leg that gets the anesthetic?
Yes, as long as the catheter has anesthetic flowing through it, the leg will stay numb. As long as it's properly positioned and there's no malfunction in the pump, then the leg will remain numb.
How numb would it be? Like, would there be any feeling in the toe, like if you poke her toe?
Nope, there is no feelings. We actually tell patients when they're walking around for several days to watch their foot.
Yeah.
If they bump into the coffee table, they're not going to feel their foot hit the coffee table. So the foot does stay numb. Majority of the time, the sensation is gone, but the motor function will remain. So even though they can't feel it, they could still move their foot if they needed to. But majority of the time, they just have it in a cast or a splint. So they just keep the foot still and it's numb for about 3 to 5 days, depending on the size pump that we put on. It's fairly common in bariatric surgery. It's also very common in cardiac surgery. When they do an incision down the middle of the chest, they'll lay a catheter, not quite the same as this. That one has holes throughout the whole length, and put up to an IQ pump. Here at Northwest, we use them quite a bit for plastic surgery, for breast augmentation, and for some of the abdominal procedures. They'll lay a catheter, again, that has holes through the length of the catheter, and hook it up to the IQ pump. So it injects local anesthetic along the whole length of the incision. So they use them frequently for plastic surgery as well.
Does it make a difference if the patient, has a high tolerance for pain and they don't really want to have this kind of device?
Some people say that until they have surgery.
And then they'll change their mind on the next one.
We have several people I've had where they come in for multiple procedures, one foot and then the next foot. The first foot they don't have it, they want it the second time. And every patient that's had it the first time definitely wants it again the second time. The majority of patients say they'd rather have a numb foot versus a painful foot. So they prefer to have it numb.